Latest figures on the state of the NHS released today, revealing that January was the worst month on record. More patients waiting in A&E than ever before. Only 85.1% of patients were seen within the 4-hour time frame. In January, the target, as you remember, is 95% to be seen within 4 hours. A bit more detail then. Once again, key targets for A&E and on ambulance waiting response times were missed in January. In fact, they haven't been hit for almost 2 years now. Patients in accident and emergency should be admitted or discharged within 4 hours in 95% of cases. In January, that happened only 85% of the time. The figures show nearly 1,000 patients had to wait over 12 hours compared to just 158 in January of 2015. Ambulances ought to reach patients with life-threatening conditions within 8 minutes in 3/4 of all cases. In January, that happened just 2/3 of the time. If a GP suspects you might have cancer, you should start treatment, according to the guidelines, within 62 days. In 85% of cases, 79.7% is the lowest on record. Well, speaking earlier today, the Health Secretary said the government remains committed to the A&E target.
It's not going to be overnight, but it is essential, and I am expecting the NHS to return to that target during the course of the next calendar year and make very tangible progress towards that target during this year. Some of the tools now have been put in place, but also it's going to take a huge focus by management and staff in the NHS to do that. But we're absolutely committed to this target. We think it's the right thing for patients and the right thing for the NHS.
That's the political response. We're giving you the statistics as well. Let's turn to our West of England correspondent, Rebecca Williams, who's at the Bridport Community Hospital in Dorset. Rebecca, welcome to you. Sometimes when we look at the figures, we look at the numbers, we get a picture that's based on statistics. It's actually when you talk to people, you get a flavour of what's happening as well. What are you hearing?
Well, yes, the A&E figures are certainly pretty shocking, but when you look at this delayed transfer of care, that's something that's an issue here and at many hospitals across the country, because here pretty much all of the patients are over the age of 65. And so this is the so-called bed blocking issue, horrible term, but it's when people are staying in hospital for longer because they don't have yet a nursing home place or there's not the care in place for them to be treated in their own homes. Now, just to give you a flavour of these statistics released this morning, there was a 23% increase in hospital days lost through delayed transfers this January on last January, and in one day in January this year there were 7,000 delayed patients, so that's a record so far. Now I'm going to bring in Bill here, who is a staff nurse. Bill, just talk me through, this is a hospital with a lot of elderly patients. What impact does that have on the services?
Yeah, obviously our job is to rehabilitate people, get them back into the community, but because there's no placements for them to go to, we're struggling. It has a knock-on effects on the main hospitals as well, and it's generally getting worse every year. It doesn't seem to improve at all.
And it's been busy, and they need more staff here, especially nurses, don't they?
Yes, yeah, we have got a big recruitment drive going on, and it is starting to show results, but it takes time, as with everything else.
We will let you get on. Thanks ever so much for speaking to us. They have got this big recruitment drive on at the moment, and they've gone to London as well as the local area to try and widen their pool. We heard earlier on today Jeremy Hunt talk about the relationship between social care and the NHS. He described it as being part of the same family, and we've heard also from the Chief Executive of NHS England. He's written to the hospitals today, and he has said that some of this money, we've seen £2 billion is going to go into social care in the budget. £1 billion will be made available straight away, and he says that that should free up around 2,000 to 3,000 beds. And I just want to show you this gentleman here, because he is about to go off to a nursing home any minute, and he's been waiting for some time for one, but they have found him one now, and he's been in this hospital a good few months. I think he was first brought in October, went back home, back in again, but finally back to a nursing home, and I think he's looking forward to it. Back to you.
Thanks, Rebecca.